The heels are very prone to developing pressure ulcers, and in some cases, especially if the patient has diabetes, can result in severe harm, amputation, or even death. Heel pressure sores are the second most commonly found ulcers on the body, and because of these additional risks, must be treated with extra caution. However, many of these ulcers are avoidable with the right products and procedures in place, and when healthcare professionals are aware of what to do to prevent them. As nurses and carers, you may not feel this makes a big difference to your authority's overall budget, but pressure area care is one of the most expensive and time-consuming areas of healthcare. It is estimated that about 4% of the total NHS budget, that's somewhere between 1.4 and 2.1 billion pounds, is spent each year on pressure area care. Each pressure ulcer could add up to £14,000 in additional costs to care. The Repose foot protectors from Uni-medical are a clinically proven and cost-effective answer to preventing pressure ulcers on the heels. They can be used on all patients that are at risk of developing pressure ulcers, including those at very high risk. They can also be used to treat existing grade 1, 2, 3 and 4 pressure ulcers. It provides comfort and effective pressure redistribution and is easy to use. First, remove the Repose from the tube. Refit the two tubes together to form a pump. Connect the valve on the pump to the valve on the Repose product. Inflate the Repose until you hear air escaping from the pump valve. Stop pumping and wait until you can no longer hear air escaping. Cover the valve on the Repose product using the solid end of the valve cap. With the product inflated, the heel sits over a pocket of air, meaning there's no pressure on the heel. This zero approach is called offloading and is the only safe way to help protect heels from ulceration. The product is maintenance-free, but you will need to check periodically that it hasn't become deflated. If required, Repose can be easily washed with soap and water. First, wash down using detergent, rinse with fresh water and allow to dry. If necessary, it can be decontaminated with a chlorine-based disinfectant. Then, rinse again in clean water and allow to dry. To deflate and store the foot protectors, first insert the open end of the valve cap into the foot protector valve. Air can now escape. Starting at the end furthest away from the valve, roll up the product to squeeze the air out. Fold and insert the foot protectors into the pump and refit the two tubes together and rotate until the tubes click closed. Once you've finished with the product, it should be returned to the equipment store where it will be cleaned, disinfected and stored ready for the next patient who needs it. Repose products have a wealth of clinical evidence demonstrating their efficacy and have been used successfully by the NHS for over 15 years on almost 2 million patients. They are lightweight and easy to carry, durable and effective, perfect for acute and community settings. For pressure care, rely on Repose.